This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch Wisconsin Eye on Spectrum Channels 995 and 363 and at wisi.org.
You are indoors in a space that is not your own home.
Second, wear a mask anytime you're around others who you don't share a home or a living unit with.
Next, always wash your hands before and after putting on or taking off your mask.
And remember, not to touch it or move it around without washing your hands.
And finally, a mask or face covering is not a substitute for physical distancing. Please continue to maintain 6 feet of distance between you and anyone who is not a member of your household.
These steps are critical to our efforts to box in this virus and keep Wisconsinites safe. So mask up, Wisconsin.
And let's get through this together.
Thank you for joining us. This briefing is being aired live on YouTube. Joining us for today's briefing are Governor Tony Evers, DHS Deputy Secretary Julie Willems Van Dijk, and also available to answer questions are DHS Bureau of Communicable Diseases and Ryan Nilsestuen, the Chief Legal Counsel in the Office of the Governor. And we'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thank you for joining us today. This week, folks 65 years and older started getting their first doses of the vaccine. From going to work, seeing their grandkids, or just going to the grocery store with a little more peace of mind, this is a great step forward for one of our most vulnerable populations. Overall, we have administered well more than 400,000 vaccines, fully registered almost 1,500 vaccine providers with 884 vaccinating entities administering vaccinations all across 72 of Wisconsin's counties. And we continue to have record-setting days for Wisconsin in the number of vaccines administered. And we are working to get shots in the arm as soon as we have vaccines available to do so. We also announced finalized groups for Phase 1B. In addition to our first responders and our folks over 65, this group will also include education and child care staff, including out-of-school and community learning programming staff, virtual learning support, faculty and staff in higher education settings who have direct student contact. It also includes individuals enrolled in Medicaid long-term care programs, non-frontline healthcare essential personnel, folks in congregate living settings, and some public-facing essential workers like public transit workers and workers in the food supply chain, from hunger relief organizations to agricultural production to grocery clerks. Eligibility for these groups will open tentatively March 1st. If we have more supply available, we may be able to start these vaccinations even earlier, but it all depends on our state supply. I was encouraged to hear that the Biden administration announced states will be getting more vaccine next week, and that they hope to start giving a few weeks' notice on any changes to vaccine allocations. That transparency and urgency wasn't there before, so we're hopeful this will make a world of difference in our preparation and planning. But no matter how you slice it, it's going to take time. So it's absolutely critical that we continue to stay home, practice physical distancing, and wear masks whenever we go out. On Tuesday, the state Senate voted to strike down our public health emergency declaration and our statewide face covering requirement. Just as they have done time and time again, putting politics above public health and attempting to throw one of the few statewide mitigation strategies we have left out the door. This resolution is now in the hands of the Assembly. Masks are a critical, important tool to keep our families and neighbors healthy and safe. I know it. The public health experts and the medical professionals know it. And Wisconsinites know it. That's why we need Wisconsinites to continue doing what they can to stay healthy and safe, regardless of what does or doesn't happen in this building. Wearing a mask is not a political statement, and it shouldn't be up for debate. Wearing a mask saves life, period. Well, the vaccine is here, and I know we're all eager to put the pandemic in the rearview mirror. COVID-19 has not gone away, and that means our state's response can't stop either. I proposed a compromise COVID bill based on the conversations I had with legislative leaders. And when that got thrown out the door, I was glad to come back and work with the Senate on another compromise which passed with bipartisan support. Now, more than 285 days since the bill was last sent to my desk, and with a bipartisan option on the table, Republicans in the legislature have yet to come up with a different version of the bill. There's frankly no reason not to work together to pass a comprehensive compromise bill. That's what the people expect us to do, and it's what we should do. It's taken way far too long to get this done, and it's time for the legislature to get on board with that compromise, the one that's already made it through one house on a bipartisan vote. Wisconsinites don't care about political points or who gets the credit. They just want to know their family, their business, and their neighbors are going to be okay. Let's get it done. With that, I will now turn things over to DHS Deputy Secretary Julie Willems Van Dijk. Julie, all yours.
Thank you, Governor. And good morning, and thank you all for joining us so early today. As of today, we've administered 476,854 doses of COVID-19 vaccine, so closing in on that 500,000 mark, and 91,058 of those were second doses, which means that 91,058 Wisconsinites have completed their vaccine series. The vaccination effort here in Wisconsin has been a series of difficult decisions on eligibility, and we have based those decisions on risk of exposure and on vulnerability. To be clear, another way to put it is that we have made decisions based on stopping the spread of COVID-19 and based on saving as many lives as possible. We will continue to use these considerations moving forward. Today, I am asking you to do the same, because you don't have to work at DHS or be in state government to make a difference. Every single one of us can take action to stop the spread and save lives. Saving lives is why we expanded eligibility to Wisconsinites age 65 and older. 87% of the people who have died of COVID-19 in our state are in this age group. So yes, we are prioritizing the older adults in our state for vaccine administration. At the same time, you can prioritize them by taking steps to stop the spread and protect them and you from catching COVID-19. Stay home, wear a mask, physically distance, wash your hands, and get tested if you have symptoms or have been exposed to COVID-19. Given the current debate in our state, I want to focus on masks for a moment. Masks are an incredibly important tool to stop the spread because they prevent the transmission of the virus by forming a barrier for respiratory droplets. The science shows that they work. In fact, the science shows that mask orders work because masks are most effective when everyone wears them. My mask protects you, your mask protects me. Together, our masks protect everyone in Wisconsin. We take care of our neighbors in Wisconsin, and we watch out for each other's well-being. During the 1918 influenza epidemic, Americans wore masks to protect each other. Wearing a mask was seen as our civic duty to protect each other and the soldiers fighting in World War I. It's over a century later, but in 2021, wearing a mask is a civic duty again. It is how we protect each other, how we take care of our neighbors, how we stop the spread, and how we save lives. So it's not vaccines or masks, it's vaccines and masks to move us to the elimination of COVID-19 in Wisconsin. Because the fact is that COVID-19 is still spreading and people are still dying. Yesterday we added 1,567 new cases, which brings our total confirmed cases of COVID-19 to 539,915 cases. Our 7-day average of cases is 1,392 cases per day. That is lower than it has been for months, but it is still far, far too high. Today we are reporting 49 more Wisconsinites have died from COVID-19, which brings our total deaths to 5,860 people. Our thoughts are with the families and friends who have lost loved ones to this virus, and it is up to all of us to take action and wear masks to help prevent further loss. Thank you, and we welcome your questions.
Thank you. And a reminder to maintain audio quality, please keep phones on mute until it is time to ask your question. Please use *6 to unmute your phones. In the interest of time and to ensure that everyone gets a question, please one question per reporter per media outlet. And we'll begin this morning with Kia Murray from Fox 11 in Green Bay. Kia?
Hi. Thank you guys for taking my question. It has to do with the news that came this morning on the Johnson & Johnson vaccine. It says that, it does what it's supposed to do. It does protect against COVID-19, but not as effective as the 2 doses that we've seen, coming out earlier. How hopeful are you that the Johnson & Johnson vaccine will have a tangible impact on COVID-19 in Wisconsin?
Sure, yeah, I'd be happy to. It's an exciting time overall that we're getting more data on a larger number of vaccine products. The 2 messenger RNA vaccines that we're distributing right now had very, very high levels of effectiveness and safety in their clinical trials. And the second and the third, fourth, and the subsequent ones that are likely to be coming to market might have lower rates of efficacy in clinical trials. But even before we saw any of these trials, the FDA and public health leaders signaled that imperfect vaccine efficacy, even products that have as low as a 50%, could have a very significant public health benefit. So we are in the phase where we are accepting all possible tools that can reduce the risk of transmission, even if they're less than 95% as our currently authorized vaccines are. So provided that they are safe, that the data are solid, that the science really convinces us that they do a net benefit, there will be a use for them. And there'll be some difficult decisions on how they fit in our distribution scheme, but we need desperately as many tools to prevent the spread as we can. So even vaccines that have less than 90% effectiveness could have a role.
Thank you. And we are experiencing some audio issues this morning, so please bear with us as we work to fix those. But right now we'll continue with Sean Kirkby from Wisconsin Health News. Sean.
Hi, thank you for holding this. I was wondering, are there any other federal funding or regulatory impacts from ending the public health emergency declaration beyond the food share change and the indoor mask mandate? And if so, can you talk about what they are? Thank you.
I can answer that question, Sean. This is Ryan Nilsestuen. The main one that we're aware of is the food share implication, and as a reminder for folks, the legislature, by threatening to vote down the public health emergency, is putting at risk around $50 million a month in food assistance, which would jeopardize 390,000 households in the state from being able to put food on their table. And that is the main federal program that's implicated by this reckless action.
Thank you, Sean. Now to Joshua Pegaro from WBAY-TV in Green Bay. Joshua? WBAY-TV. Okay, we're going to move on then.
Hello?
Oh, is this Joshua?
Hello? Yes. Sorry about that. One of the questions I had was in regards to the CDC data, and there were other stories circulating about Wisconsin being one of the slowest states, or having the slowest rate in vaccinations. Can you add more context to that in terms of what it shows, why that's occurring?
Well, let me be clear about one thing. The CDC data is about 3 days behind the Wisconsin data, and as we look at other sites, we see them uploading our Wisconsin data and other states' data more quickly. So I really caution people about these comparisons on different sites, that they may not be apple-to-apple comparisons. Let me just give you an example of that. If you look at the CDC site this morning, it has 114,937 doses less than what we just reported. That translates into a rate per 100,000, which is how many of these sites are ranking people. CDC says we vaccinated 6,216 people per 100,000. If you calculate it using our accurate data this morning, it's 8,222. So 25% more is a really significant difference when you compare site to site on this. So what I want people to understand is that we are moving forward. We are advancing vaccine. We have had several record days in a row. We gave over 45,000 doses of vaccine in this state yesterday. And so our vaccinators from public health, from health systems, from pharmacies, are actively getting shots in arms and protecting lives here.
Thank you, Joshua. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yes, thanks for taking my question. My question is for the governor. I know that the Assembly has a couple of things that they keep trying to re-add to the COVID relief bill, things like not shutting down churches, things like making sure that employers aren't allowed to mandate the vaccine. My question is, many people in the media have kind of assumed what the sticking points are here. But what exactly is it that you will not accept in a COVID-19 relief bill out of the State Assembly? Thank you.
Sure, and I haven't seen the final bill. I presented a bill that dealt with many more issues than the present one does, but it included all those that the Speaker and the Majority Leader in the Senate agreed to. That didn't go anyplace. Then we went ahead and we developed a bill that we had agreement in the Senate, and those pieces actually were part of the original bill. So, and I don't know what's going to end up in the bill. So I'm not going to sit here and assume that we have the final bill. The Senate has yet to act on a highly inappropriate bill, in that we had appropriate bills that had everybody's agreement on. So I haven't seen the final one, so I'm not going to tell you what I'm going to sign or not sign and why I won't sign it. I'm hopeful that when it comes back to the Senate that they actually go back to the piece that we had agreed to with them.
Okay, well, thank you, Rob. And again, we are aware that we are having some audio issues, and we are working to fix those. And we will continue, though, with Todd Bridgman from the Associated Press. Todd?
Good morning. Question either for the governor or for Julie. How is it that the Milwaukee Bucks chief executive was able to get vaccinated yesterday at age 33?
I'll jump in there just quickly, and I read the story. As some folks know, we encourage people that are vaccinating other people that it comes to the end of the day, rather than throwing out a dose of vaccine, they should just get it in somebody's arm. Now, whether that happened in this case or not, I haven't the faintest idea. I personally and my wife have not jumped the line. We're still waiting for our primary care physician to give us a call, and we'll go at that time. But I don't know the circumstances under which that happened.
Okay, thank you, Todd. Now to Stephanie Hoff from West Politics. Stephanie?
Good morning, everyone. My question is for the governor. So what are you planning to do in case the emergency order is overturned? And from my perspective, it looks like you have at least two options to keep declaring emergency order or disaster, in which both would keep the extra food stamp money. Thank you.
Well, there's a third option, and that is that it hasn't been passed yet. My present order is in place, and I'm encouraging the Assembly to let it continue to play out. It is important for people to remember that wearing a mask saves lives, and I'll continue to say that. And it is not about individual liberty, as others would say. If some of those arguments would be in place, I would expect the Assembly and the Senate to be sending me legislation getting rid of the speed limits on our highways so that people aren't constrained. Their liberties to go 100 miles an hour aren't constrained. Obviously, that's ridiculous, and getting rid of this mask mandate falls into that same category.
Thank you, Stephanie. Now to Will Cushman from West Context. Will.
Good morning. I'm wondering if you might have a status update on your work with Microsoft on developing an online platform for signing up for vaccinations, and whether you might have an updated timeline for when such a system might come online. Thank you.
Sure, I can take that, Will. We have a signed contract with Microsoft, and work has begun this week to set up the system, to basically Wisconsinize it and make sure that all of the questions that are being asked are customized for Wisconsin, and that all of the scheduling parameters are in there. And the work to build the system for our state takes about 3 weeks. So we will be launching it the week of February 15th. We will start in 10 communities who will test it, and we'll work out the kinks that week. Any of you who have ever launched a new software know that there will always be a few things to fix, and then the following week already have communities lined up to spread it much more widely across the state. And concurrently with that, then, we'll be able to set up the website where people can see where community-facing clinics are, that they could use that software to register. For people who have used COVID Connect, the software we've used for our community testing sites, this will look very, very similar. It's built very much like our testing platform, and so the same process of logging in, registering with your demographic information, answering some questions to determine your eligibility, and then if you're eligible, you'll, in this case, be able to schedule an appointment, and then you'll receive an email with a code that you'll show when you come to that appointment. If you're not eligible yet, the system will put you on a waiting list, and so you'll be notified when you are eligible, and you can go back into the system and schedule your appointment. Now, I want to add one thing about this is an awesome system. It'll work really well. It has worked very well with testing. But one of the challenges we have is we have vaccinators all across the state ready to put up these type of community systems, community clinics. And right now we just don't have enough vaccine. And so many of them will be working much fewer days or shorter hours than they may be able to work because the vaccine supply is limited. So it's really vaccine supply that is our limiting factor right now. But the good news is we will have this system and we have vaccinators in place for the days when the supply increases.
Will, and we are going to pause a little bit to take care of our technical issues. We will be back in a moment.
when the supply increases.
You will, and we are going to pause a little bit to take care of
when the supply increases.
You will, and we are going to pause a little bit to take care of our technical issues. We will be back in a moment.
And at
And welcome back. We do appreciate your patience as we worked on our technical difficulties, and we will pick up where we left off, and that is with David Wahlberg from the Wisconsin State Journal. David. And again, David Wahlberg. And I'm sorry, David, we were unable to get your call. We'll try to come back to you. Let's move on then to ERIK GUNN from Wisconsin Examiner. ERIK.
Hi, I want to make sure you can hear me. Okay. This is a little bit of a complicated question for the governor. The lawmakers who want to vacate the emergency have been claiming that their issue is with the various orders being an extension of the previous expired emergency order that disregards the 60-day limit after which the legislature has to weigh in. Now, I understand that the administration disagrees with that premise, and of course we know it's being litigated in the court. Notwithstanding that, during the months since the original mask order, once that argument about the nature of these orders was raised, I'm wondering if you or your staff approached the legislature to discuss either the concept or a specific proposal that would have codified the order into a law with the legislature's backing? And if so, what was their response? Or if not, why did you choose not to do that? Thank you.
Well, we're always open to having a discussion with the legislature around mask orders. The only alternative they ever gave us was to put it in an administrative rule, and we tried to do that right from the beginning, and we were rebuffed by the Republican leadership of the committee, and that was that. So there's like no other options. You either have a order or administrative rule, and they chose to say do an administrative rule, and we did it, and we got kicked out. We got kicked to the curb. So no, I'll just say it again. This issue is about saving lives, and if the Republicans are going to use the issue of improper order that frankly has not been decided by any court or by the Supreme Court, we will continue to talk about the importance of doing it. And if it's unbelievable to me that we can have the entire health world opposing them striking down this order, and they ignore the science, they ignore the people that implement the science. The options are few. Anyway, our order is still in place. The Assembly does not have to kick it down the road. So that's what I'm hoping for. We'll see what happens.
Thank you, ERIK. Now to Kent Wainscott from WISN TV in Milwaukee. Kent.
Hi, thank you. I just want to follow up on your urging urging vaccinators to make sure at the end of the day they get any unused doses into people's arms. With such a limited supply of vaccine available and so many people in the eligible categories, is there a problem in the distribution system that would allow any doses to go unclaimed at the end of the day by eligible individuals? And what's being done to correct that?
So let me talk a little bit about how the vaccine comes and why sometimes there are unused doses at the end of the day. So the Pfizer vaccine comes in a vial that was marketed as 5 doses. We've now learned you can get a 6th dose out of that vial. So especially in these early weeks of vaccination, there can be times you planned for 5 doses per vial and you're getting the 6th, and so you have extra doses. Now people have been adjusting knowing that that sixth dose is usually there, although I have also heard from vaccinators not always there. So the other thing about the Pfizer vaccine is, remember, this is the vaccine that has to be held in very cold storage. And so once you've taken it out of the minus 80 degree storage and put it in the refrigerator, you only have 120 hours to use it. Once you've taken it out and put it at room temperature, you only have so many hours to use it. And so if every factor doesn't line up right, you planned for 30 people to come to your clinic, you have 6 vials, now you realize you could get an extra dose out, so you could give 36 doses. You might have extra doses you want to give to people. Or you plan for that number of people and 5 people don't show up. You have that same issue. With the Moderna vaccine, there's 10 doses per vial. And so once you've gone into a vial in a day, you can't just put it back in the refrigerator and use the rest tomorrow. You have to empty that particular vial. And so again, let's say you were planning for 50 people, you had 5 vials, 41 people showed up. Now you got 9 doses left in that vial. So that is how this happens on a practical, pragmatic basis. Many of our health systems are keeping waiting lists of people for, if there are extra doses at the end of the day, so they have people they can call quickly to do that. Many of them are triaging those lists. So if the waiting list, if you're over 65, you're going to be the first one called. And so it is just a practical part of this strategy. And again, as the governor said, we don't want a dose wasted. We need all these doses in arms, and that is how this can happen, even with excellent planning.
Just in addition, all the things Julie talked about are absolutely accurate. In addition, what happens if you have 80 inches of snow? Suddenly, you have 50 people scheduled to come in. It could be far less than that because they can't get there. And so people have to understand this isn't a precise science, and that a lot of different things can happen. That's why vaccinators must have a backup plan to get shots into people's arms, even under those kind of weird situations that can happen.
Thank you, Ken. Now to Denise Lockwood from Racine County I. Denise?
Good morning. My question is around the hospitalizations. It's obviously the number of people that are being hospitalized is decreased significantly. But I was wondering what the role of the monoclonal antibody treatment has been and how many doses of that have been given.
I don't have the precise number of doses that have been given. That is something we could ask our team to research and provide to you, Denise. And I turn to Dr. Westergaard to talk about the effectiveness of this treatment, its impact on hospitalization.
Sure. I don't think, similar to what Julie said, we don't have population-level data that really estimates the impact, how much did this cause. But what we know about the efficacy of the treatments themselves, they did, when they were given to people, particularly people with high risk for hospitalization, there was a modest decrease in the risk of hospitalization. So they received emergency use authorization based on those data. So they are one of our many tools to try to prevent severe disease and deaths. The rollout, I think it's definitely a minority of infected individuals who receive these doses, but I'd be happy to help follow up with the precise number in Wisconsin of doses if we can get that.
Thank you, Denise. Now to Dan Malloy from Spectrum News. Dan. Dan Malloy from Spectrum. Okay, moving on then to Madeline Anderson from WITI TV in Milwaukee. Madeline?
Hi, I saw that the alternate care facility hasn't had any patients in quite some time, and I was just wondering what the state's plan is in terms of, are you going to keep it open? Are you going to close it? And could it maybe be turned into a max vaccination site potentially down the road? Thank you.
Thank you. We continue to monitor our hospitalization rates, the rate of disease, and evaluate whether we should continue to keep the alternate care facility available or not. Certainly one of the factors that we are considering is what patterns we may see with the new variants that are emerging across the world and are certainly present here in the United States. So it's that great balancing act about you don't want to close it too early in case we would see additional surges in disease related to the variants or other causes, but you also can't keep it open forever. So we are actively in evaluation of those items and considering other uses for State Fair Park as we move forward.
Thank you, Madeline. Now to Mary Spacuzza from USA Today Network, Wisconsin. Mary?
Thanks for doing this call. Can you explain how the process works for allocating, transferring, deferring, canceling doses to or from the pharmacy partnership program? We were getting a little confused about the different terminology that was used, and we wanted to get a sense of how many doses are currently in that pharmacy partnership program now, because I know some have been canceled or deferred.
Sure. I can try. This will get a little technical, but so when the program was started, there were two parts. Part A is skilled nursing. Part B is for assisted living. CDC determined how many doses we needed to allocate to each part of the program. 56,800 for the skilled nursing, 140,000 for the assisted living. All 56,800 doses have been transferred to CVS and Walgreens for the skilled nursing program. And I'll have to get you the exact number that have actually been transferred to the assisted living program. We are doing a number of shifts right now, and so I don't have that number right at the top of my head. The reason we are doing some shifts right now is because CVS and Walgreens have completed the skilled nursing facility, so they know exactly how many doses they needed for that program. And it is fewer than the 56,800. And they are now, as they begin the assisted living program, doing that same kind of evaluation. And so we're looking at that. We don't want to short doses to CVS and Walgreens. They don't have enough doses to administer to our vulnerable elderly residents of those facilities. But we also don't want to give them too much vaccine, because once they have it, they will use it, but they will use it through their retail pharmacies for Wisconsinites. And if they're not going to use, for example, 30,000 doses, we might want to bring it back and use it in other avenues for Wisconsin residents. In addition, I can tell you we canceled 12,000, I believe it was 12,700 doses. We can confirm that number. We canceled on the assisted living program 12,700 doses with CVS because they told us clearly we're going to be under, and that was the weekly allocation to CVS for those doses. And those doses are being redirected to independent pharmacies and, in some cases, local health departments who are vaccinated assisted living facilities. Because as we've discussed before, some of the assisted living facilities, there are so many that CVS and Walgreens have asked for assistance from other vaccinators. So those vaccines were canceled from the pharmacy program, put back into the vaccine stream for our Wisconsin vaccinators who are addressing those populations.
Thank you, Mary. Now to Emily Davies from WSAW TV in Wausau. Emily.
Thank you for taking my call. My question is also related to the assisted living pharmacy program. I talked with an assisted living facility earlier this week, and I guess if you can explain a little bit further about when they'll be able to get vaccinations to people. An assisted living facility in our area that I talked with mentioned that they don't even know who's going to be vaccinating them. They've actually asked the residents to start signing up that are eligible in the 65 plus to start signing up with their own healthcare providers because it might be faster. I guess, can you talk a little bit more about when and if that's advised?
Yeah, the plan for those who will be vaccinated by CVS and Walgreens is that they will be vaccinated, receive their first dose of vaccination. Let's remember, this is a 2-dose series. So their first dose in February. Again, as we've said all along, we have a lot of facilities in this group and a lot more than a lot of other states. And CVS and Walgreens are finding that out as they go to schedule people. I know they are also looking at bringing in staff from other states to assist with that. If there are assisted living facilities who are uncertain, we encourage them to contact us. We can help them determine who is vaccinating them and help clarify communications if that is becoming an issue. But they are reaching out to those facilities. The program officially began this week. They had already started reaching out last week, and they are moving forward with scheduling and coordination of that, and the plan is to reach all of them in the month of February.
Thank you, Emily. Now to Mason Dowling from WAOW-TV in Wausau. Mason?
Hi, this is Natalie Sapila in for Mason right now. Thanks for taking my question. I wanted to ask, we've noticed on the DHS vaccination page that women more than double men in vaccinations in Wisconsin. I'm wondering if you guys have any insight into why that is. Thank you.
Yep, absolutely we do. If you look at the healthcare workforce, I think you will see a very similar gender distribution. And remember, our early stages of vaccination have been largely focused on the healthcare workforce, which is the biggest proportion of current people vaccinated. You know, certainly our hope is as we diversify who is receiving vaccine, you'll see more evening out of the demographics, and we strongly encourage all genders to seek vaccine for their protection.
Thank you, Natalie. Now to Jessica Van Egren from Up North News. Jessica.
Yes, my question is for Dr. Westergaard. With the different variants of the COVID-19 virus coming over, we've started to hear some suggestions as far as double masking is concerned. Do you have any thoughts on whether that is something that people in Wisconsin should start to do? I guess that's just my question on double masking, if it really works, if it's worth doing it. Thank you.
Sure. Yeah, it's a good question. There's been a lot of discussion about this locally and nationally. There's not great scientific evidence that one mask is better than two. It's never been studied that way. But we do know a fair amount, particularly when it comes to homemade masks, that not all mask designs are created equal. And what I mean by that is when we've done studies to see how well different types of fabric block respiratory particles from being spread into the environment, they really need to have multiple layers. So a single layer of cotton, like a bandana or a fleece neck gaiter, there have been some studies that show that the particles pass right through those. So one simple rule is that if someone is wearing a mask that's not a medical grade mask, it needs to have multiple layers, and wearing two masks might be one way to make sure that there are multiple layers. The other key to the success of masks is that they fit well around your face so that the air goes through the mask and not around. So some people have found that wearing two masks might result in having a closer fit to the face, and that's also another reasonable way to do that. So I think those are the important principles. I don't think we're recommending that everyone wear two masks as a rule, but people should be aware of why and how masks work, and if using a strategy of two masks for a better fit or better filtration is an option, then I think it's reasonable to do that.
Thank you, Jessica. Now to Erin Sullivan from NBC 15 in Madison. Erin. Aaron Sullivan? Okay, we'll move on then to Emily Fannin from CBS 58 in Milwaukee. Emily?
Hi there. Thanks for doing the call and appreciate you guys fixing the audio issues. Governor, this question is for you. I know you've said a few times on this call that the mask order, of course, hasn't passed the resolution in the Assembly, but Speaker Voss said they will eventually vote to revoke your mask order. So will you issue a new emergency order requiring Wisconsinites to mask up, if not a matter of when the current one in place is struck down by the legislature?
Well, certainly it's, Emily, that I've been a mask advocate from the beginning. It's an easy thing to do because it saves lives. So I will continue to make that promise that the people of Wisconsin will do everything in our power to make sure they're safe, and as we consider what role we will play going forward. But I'm still, until it happens, I mean, you've seen the last couple of days of bouncing around from each house to each house, and I think it's premature at this time. I know what the speaker said, but until it's done, it's not done, and we still have a mask mandate in the state of Wisconsin.
Thank you, Emily. Now to Taylor Lumpkin from TMJ4 in Milwaukee. Taylor.
Hi, good morning. How are you guys? Just a quick question. I wanted to piggyback off of a couple other questions, really, but just going back to the Milwaukee Bucks VP who was vaccinated. I understand that you don't want to see any of the vaccinations go to waste, and I know we're kind of goes up in the air, but you know, would you like to see a better system in place in terms of when the vaccine goes to, you know, someone who is really in need, when it comes to someone who might be at risk, or is it really just up to the different healthcare systems, healthcare providers, as in terms of how they want to go about giving those leftover doses to either those in the 65 and up group or to anyone who just might be available for it?
And I'll just try again. First of all, I obviously don't know the circumstances of the specific issue, but there may be times out of the 460,000 or the great number of vaccinations that we've had, there may be times where when we're telling people to get a shot into somebody's arm, out of those 460,000 plus people, that some of them may be kind of out of sequence. I would rather have that. And it's going to be a small n. It's going to be a percentage of a percentage of a percentage. And I'd rather have them do that than throw something away.
And if I can just add, every one of our vaccinators signs an agreement with us that says they will abide by the prioritization that has been established by the Advisory Committee on Immunization Practice and our state Disaster Medical Advisory Committee and DHS. So they know who they are supposed to vaccinate, and if they perpetually violate those recommendations, we talk with them, and if they would continue to do that, we have the option of not giving them more vaccine. We have talked to a number of places where we know there were misunderstandings about how they were moving forward and have seen changes in behavior on that. And we have also, as I said, mentioned that we control the vaccine supply. And so if there are perpetual violators of that, that is an option. But we have also said to them, as the governor says, get the vaccine in arms, and there is no way we can police every single vaccine that is put in an arm at the end of the day.
Thank you, Taylor. Let's go back to David Wahlberg from the Wisconsin State Journal and see if he's available now. David Wahlberg?
Hi, can you hear me this time?
Yes, we can. Thank you, David.
Great, thank you. I just wanted to confirm, I think you said 45,000 doses yesterday. That seems like it would be about 125,000 so far this week then, and that doesn't include today. I'm a little confused how you can give something like 130 or 40,000 doses in a week when you're only getting 70,000 from the government. Is that just because of the booster shots or what? And then also, can you say how many doses have been given in nursing homes and in assisted living so far?
So, David, I want to be very clear. We say 70,000 first doses a week we receive from the federal government, because we're measuring it based on how many new people can come into the system. So, and that is how they give us our allocation, is in first doses, and then they also add the booster doses onto that. So the fact that your math is showing we're at about 125,000 reflects what we are seeing, which is, I mean, yesterday it was about 35,000 people received first doses, and about 8,000 or 9,000, I don't have the numbers right in front of me, received second doses. So it is a combination of both. We can get you the skilled nursing and the assisted living numbers, but we'll need to follow up on that. I don't have those data right in front of me.
Thank you, David. Now to WKOW TV in Madison. WKOW.
Hi, good morning. This is Nick. So does Wisconsin have any purchasing power to buy its own vaccines instead of going through the federal government if the concern right now is how much we are getting from them?
Well, I'll just mention something just on a broader scale. We experienced the Wild West one other time in this pandemic with protective equipment, and it doesn't work. The idea that somehow we're going to compete against other states and actually be able to do it when we're a relatively small state, about 2% of the U.S. population at best. So the opportunity for us is not good. This should be done at the federal level. We don't need the Wild West. It'll turn into a mess, and we won't be able to recover from it. So I'm against doing that, and especially as a small state. Yes, we could combine ourselves with other states. We tried to do that with PPE. That didn't work well either. So that's the 30,000-foot view of it.
Plus, I don't think there's a whole lot to buy.
Thank you, Nick. And our final question this morning belongs to WISC TV News 3 Now in Madison. WISC.
Hi, thanks for taking my call. Back to the Johnson & Johnson vaccine rollout, is the state developing a plan for how to handle conflicts with that? And what I mean is, I was reading Washington Post this morning. Some experts suggest that there could be an issue with people wanting to choose what vaccine they get based on efficacy. So I guess my question is, how is Wisconsin planning to deal with that particular vaccine? Thank you.
Yeah, already we have two different vaccines that people may want to choose which vaccine they elect, and that's just not possible in this situation of scarce resources. So we will get vaccines in the hands of our vaccinators, and they will vaccinate their patients. Patients always have a choice to say no if they don't want the vaccine that is available to them and wait until they might be able to find the vaccine that is. But our goal is to get all vaccine out in the hands of vaccinators as quickly as possible so that they can get it in the arms of patients as quickly as possible.
And that concludes today's briefing. Again, we want to thank you for your patience as we worked on our technical difficulties. If you need more information on COVID-19, please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good day.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.